Ontario doctors say some children and teenagers are suffering from social malnutrition during the COVID-19 pandemic because they are physically isolated from their peers due to provincial restrictions. Drive. Saba Merchant, a pediatrician based in Vaughan, said she has seen significant changes in children's lives since the pandemic hit Ontario more than a year ago. Children have been unable at times to attend daycare, school and extracurricular activities, and that has meant a disruption in routines and structure. All of the changes have led to social isolation, she said. Financial stress in families has led to housing and food insecurity in children. Children in dysfunctional families have suffered neglect and abuse. Because of these adverse experiences, Merchant said there has been a decline in mental health, social and emotional development, cognitive development, and to a certain extent, delays in language development. Lodera, I must say that what we are seeing is just the tip of the iceberg, she said at a news briefing organised by the Ontario Medical Association (OMA) on Wednesday. Merchant, owner and director of Maple Kids Clinic in Vaughan, said she has seen a skyrocketing number of cases involving anxiety, depression, suicidal thoughts, inattention, obesity, eating disorders, obsessions and compulsions in children, and the list just goes on, she said. She noted that peer interactions among children form the building blocks for emotional and social development, and these interactions have dropped. She encouraged families to do the following. The pandemic has negatively affected the mental health of children and teens, OMA doctors said Wednesday at the news briefing. They expressed concern that the effects could last for years after the province emerges from the pandemic. Drive. Daniel Rosenfield, a pediatric emergency medicine specialist at Toronto's Hospital for Sick Children and an assistant professor of pediatrics at the University of Toronto, said the hospital's emergency department has seen a 25% increase in cases involving suicidal ideation or suicide attempts in 2020, compared to that of 2019. I know other places across the country have seen the same, he said. Rosenfield said the number of emergency visits did drop significantly since the start of the pandemic, but the number of injuries, poisonings and ingestions did not decrease last year. The majority of injuries, including from cycling and tobogganing crashes, were minor in nature. For example, there were 300 cycling injuries among children that involved emergency visits in 2019, while there were more than 700 in 2020. When teens ingest such things as prescription drugs or household products, it is usually intentional and could be a sign of boredom and experimentation and sometimes indicate a suicide attempt. When toddlers ingest such things, it is usually not intentional, he said. Dr. Vicky Ferrer, an infectious disease physician at Markham Stouffville Hospital and an emergency department physician at the Hospital for Sick Children, said she hopes some children will be able to get immunized before the next year's school in September. Children are not yet eligible to receive any COVID-19 vaccines in Canada, Ferrer said. Preliminary data from Pfizer-BioNTech's clinical trial on children aged 12 to 15 suggested high efficacy in that age group. Another Pfizer trial on those aged 6 months to 12 years is in the enrollment phase now. The goal is get data by the end of 2021 and start vaccinating by early 2022. Moderna's clinical trial on children aged 12 to 18, meanwhile, has completed its enrollment stage, she said. The goal is to get emergency approval quickly and to begin vaccination in the fall. Other Moderna trials on younger children, involving 3 age groups, 6 months to 2 years, 2 to 5 years, 5 to 11 years, have begun their enrollment stages in the US, she said. Both mRNA vaccines look very promising in the pediatric population, she said. The OMA, for its part, said also troubling is the decrease in the number of children who saw a doctor in 2020 compared to 2019. The number dropped 31%, according to OHIP billing records. Interactions with doctors dropped 39% for children aged 4 to 8, and dropped 24% for newborns and children aged 3 and under. Fewer Ontario parents have been seeking care from doctors for themselves and their children during the pandemic, OMA President Dr. Samantha Hill said in a news release on Wednesday. Children have been subjected to significant disruption over this year, which has experts concerned about consequences on their development and overall well-being. This new data has us worried, because if the decreased number of visits is not the result of decreased need, there may be further long-term effects on children's health. Hill said it's not immediately clear why there has been a decrease in visits. She said it's possible that children had fewer illnesses and that families deferred immunizations and health care not considered urgent because they had concerns about the virus. She said the drop could contribute to a backlog of deferred and delayed health care. In April 2020, there was a huge drop in doctor visits for adults and children, the OMA said. For adults, the drop was 35% compared to the same month in 2019, while for children, the drop was 55%. Visits picked up over the summer and dropped off again in December. The data comes from OHIP billings by Ontario's doctors between April 2019 and December 2020 and includes in-person and virtual visits to doctors.